Good day everyone, I am Jennifer Galsote from Bachelor of Secondary Education, major in English. My topic is all about sexually transmitted diseases or STD. I have here two facts. STD are treatable but not all are curable. Women are more susceptible to STD than men. Women are more vulnerable to infection than men because of their anatomy. It's easier for men to transmit infection to women than vice versa. The sexuality transmitted diseases, STDs, or venereal diseases, VD, are infections passed from person to person through sexual intercourse or genital contact. Chlamydia, genital herpes, genital warts, gonorrhea, hepatitis B, and syphilis are among the most common STDs. AIDS, acquired immune deficiency syndrome, is the most virulent and deadly of all STDs. Did you know that chlamydia is a bacterial infection that affects millions of men and women? Its symptoms show up after 2 to 4 weeks after exposure. In women, symptoms may include vaginal discharge or irregular menstrual bleeding, painful urination, genital itching, or lower abdominal pain. In men, there may be a penile discharge and painful urination. Chlamydia is easily treated with antibiotics if undetected and untreated. It may cause pelvic inflammatory disease in women, which may lead to sterility. Genital herpes caused by the herpes simplex virus, which also causes cold sores and fever blister. It is easily spread through sexual and other direct skin contact. Symptoms occur 2 to 30 days after contact with the uninfected person. There is no known cure for herpes. Once infected, you may have recurrent outbreaks, which are usually shorter and less severe than the first one. Itching, burning, or tingling may occur at the place where the source will later appear. Medication is available that help reduce the frequency and severity of recurrent outbreaks. Genital warts are caused by the human papilloma virus, which is spread by sexual contact. They appear as a small fleshy bump or flat white patches on the labia, the lips around the vagina, inside the vagina, on the penis or scrotum, or around the anus. Of most concern to women is the link between HPV and cervical cancer. The virus can be detected by a pap smear. Warts developed on the cervix can be removed by surgery. In some cases, it may recur. Hepatitis B is a viral infection spread through sexual contact with infected blood. An infected pregnant woman can also transmit the virus to her baby. Symptoms including vomiting, abdominal pain, loss of appetite, and yellow tint to the eyes and skin. Jaundice appear 2 to 5 months after exposure. Long-term effects of the disease include life-threatening liver damage. A vaccine B is recommended for all infants and people in certain high-risk groups. Syphilis is a bacterial infection spread through sexual contact or sharing of contaminated needles. Symptoms appear 2 weeks to 1 month after contact. The first, a small red blister, ulcer or sore that appears on the genital rectal area, which may go unnoticed. The lymph nodes, the groin, may also swell. Symptoms of the second phase include skin rash, patchy hair loss, fever, swollen lymph glands, and flu-like symptoms which may lead be confused with other illness. Syphilis can be treated with antibiotics. If untreated, it will cause serious and premature death. Prevention. Preventing a sexually transmitted treating an infection once it occurs. Only monogamy, be fitten unaffected partners, or sexual abstinence completely eliminates the risk. Avoid sexual contact while your partner is being treated for a sexually transmitted disease. A cornerstone of public health is disease prevention tools to prevent STD, such as vaccine, topical microbicides, and behavioral interventions are a vital part of protecting the public against infectious disease. Gardasil, a vaccine against the four most common strains of human papillomavirus (HPV), is a existing accomplishment in the field of STD. However, the work to develop safe and effective vaccines against other STDs continues. Most notably are the ongoing clinical trials to evaluate an investigational vaccine to prevent genital herpes. Ways to prevent STD. Use latex condom every time you have sex. If you use a lubricant, make sure it's water-based. Use condom for the entire sex act. Condoms are not 100% effective at preventing disease or pregnancy. However, they are extremely effective if used properly. Learn how to use condoms correctly. Avoid sharing towels or underclothing. Wash before and after intercourse. Get a vaccination for hepatitis B. This is a series of 3 shots. Get tested for HIV. If you have a problem with drug or alcohol abuse, get help. People who are drunk or on drugs often fail to have safe sex. Consider that not having sex is the only sure way to prevent STD